Tarsal tunnel is one of the more difficult things to treat because it's difficult to diagnose. Much like carpal tunnel in the hand, there is a tunnel in the foot that we refer to as the tarsal tunnel, and it supplies sensation to the sole of the foot. The tarsal tunnel area can get irritated either because there's been a fracture to the ankle, which causes a bone spur, or there's a cyst next to the bone causing impingement, or the nerve itself is actually getting tethered and strained from a flat foot deformity. The most important thing with tarsal tunnel is to have a true diagnosis of tarsal tunnel and not just maybe it's tarsal tunnel. Tarsal tunnel surgery at best is 50% successful, but we find it can be 90 to 95% successful if there is a true diagnosis of tarsal tunnel. In order to get to a diagnosis, you need some nerve testing, you need an MRI, and you need a good examination. If you have tarsal tunnel, sometimes it can be treated with a casting, an orthotic, cortisone injection, and sometimes even a stem cell injection to regenerate the nerve. If these don't work, much like carpal tunnel in the hand, we will free up the covering of the nerve. And even that is a difficult surgery because you need to not only do the main nerve, but do the nerves as they go into the foot area. If you free up the nerve properly and you diagnose the nerve properly, we've had some significant improvements in patients with tarsal tunnel, and it doesn't have to be a recipe for disaster.